Hello everyone, my name is Brandon, and the research topic I chose was over preventing surgical site infections. So for my introduction, this topic is important to me because while working in the surgical area, I personally can see the huge impact infections can have on people and the hospital. This is important to the public because surgical site infections are the most common of the hospital-acquired infections and can actually lengthen the stay of patients in the hospital. The importance to healthcare is that each surgical site infection can actually cost the hospital anywhere from $160,000 to $300,000 per patient, which in turn, if we could reduce that, could actually save the hospital a lot of money. It's also very important to my patients because finding ways to reduce surgical site infections, we could have better patient outcomes and we could also make surgery safer, which would reduce the risk to benefit ratio of surgery. For my picket statement, so for surgical patients, does the use of antibiotics, dressings, and asepsis techniques compared to no intervention reduce the amount of surgical site infections over a 6-month time period? Okay, so database researches. So my first search was on the Cochrane database. I first used the search words surgical site infections, which resulted in 3,148 results. To narrow down my results, I used topics like infectious disease, infectious control, and wounds. That brought my research down to about 12. These 12 articles all covered types of dressings to prevent infections, the use of antibiotics prophylactically to prevent surgical site infections, and proper skin antisepsis techniques to prevent infection. To search guidelines, I chose the ERCI Guidelines Trust. Searching for surgical site infections published between 2014 and 2019, which yielded about 15 results. After going through the results, I found a perfect guideline labeled surgical site infections, prevention and treatment. I linked it down below, right there. If anyone's curious, you can go look at the current guidelines and stuff, but it gives a pretty good layout of about every aspect of surgery for like current guidelines and stuff. Okay, so this is my database searches continued. To find evidence-based practice articles, I went to CINAHL and researched antibiotics and preventing surgical site infections, and that turned up about 181 results. To narrow down the results to more specific content, the criteria that I chose was academic journals and anything published between 2014 and 2019. That resulted in about 38 journal articles, and I found two pretty good articles on there that were helpful. They were over the use of scheduled antibiotics and topical antibiotics to reduce surgical site infections. So my similarities, the similarities seen in these research topics were to test the effectiveness of certain interventions on patients and to compare the results to see if there is a reduction in SSIs. Every patient looked at or surveyed in these researches had the similarity of some type of open surgical wound that then later had to be closed. Another common ground all these researchers had was the fact that to be considered a surgical site infection, it had to occur within the first 30 days post-op. All right, so inconsistencies. The biggest problem with a lot of these researches that I found is that they don't account for time given in most of them. I talked to our infection control guy at my work, told him about my research on surgical site infections and how to prevent them. And he said just recently they have started looking into timing of antibiotics given and how important that is to give them an hour before surgery, or else they might not have an impact at all on the outcome. I always wondered why working in surgery that everything the nurse documents must be the exact time and why that is so important. But after kind of researching and reading about it, it really makes sense to me now, um, like how important timing is. Um, this also goes for a study I found on preoperative chlorhexidine baths and how there was only a slight reduction in the amount of surgical site infections found in patients. Although it showed to reduce surgical site infections, they never discussed proper timing to give those baths. Another inconsistency was in the risk factors given to the patients. So there was only one study that I found that separated patients out by how likely they were to acquire an infection and separated those groups to truly test the possibility of reducing surgical site infections in all types of populations. The study took comorbidities such as like diabetes or past infections and scored those patients on a level of risk for surgical infections. To me, not having this separation of risk factors in your study could skew evidence. I compare this to one of the other studies I found on antibiotics that stated the use of antibiotics prophylactically did not reduce the surgical site infection risk. But after digging around and kind of looking at that research, I found that they only used like healthy patients who had no comorbidities, whose infection risks were already very low. So that to me kind of can throw off the data and stuff like that. On to like gaps and limitations. With the majority of research being done in one hospital, it really limits the results of the interventions due to the fact that not all surgical floors are ran the same. Even the way like Mercy Hospital and Cox Hospital run their surgical departments can be very different and may have different guidelines that we use that could lower the risks of infection to begin with. Um, with only researching one type of surgery to test the effectiveness to prevent surgical site infections, it also skews the data because not all surgeries take the same amount of time to perform, and longer surgeries have higher risks of infections. So if all the surgeries being tested are only 15 minutes long, you're not getting to see the big picture of the benefit of the interventions. Oops, sorry, let's go back up here. Although the cheaper and easier way to acquire research is through survey and by staffing, a low number of people, um, nothing really beats like in the field seeing things firsthand. To me, like never being in surgery and seeing if guidelines are truly being followed really kind of puts a crutch on the research and like limits the type of outcomes that you can have. Okay, so on my conclusion here, to conclude my project, these four interventions above uh, show like an actual significant reduction in the amount of surgical site infections acquired after surgery. So the use of antibiotics the use of topical antibiotics, scheduled antibiotics, that goes back to like the timing thing we talked about. It's really important as far as like timing on antibiotics that I've found through research. Um, Antimicrobial dressings had a huge impact, and the use of the chlorhexidine prep on surgical sites. There was really no specific guideline that I could find on the type of interventions that I researched. Although there are no guidelines on these interventions, I see a lot of surgeons kind of following some of the interventions at my work, but they all do some things just a little bit different, such as like timing of antibiotics given. And I think it could truly benefit everyone and reduce the amount of surgical site infections if there were proper guidelines implemented. Um, Talking to the infection control guy at my work, he told me they are currently looking at implementing a lot of these guidelines that I found in my research, such as like scheduled antibiotics and the chlorhexidine. But the biggest one that he said they were actually working on right now is what time both need to be done to have the highest outcome before a guideline can be published. This last week at my work, we had joint commissions up there and our infection control guy, And it was really nice to be able to talk to him and to kind of bounce some ideas off of him. And it was also really cool to see that some of the things I had researched is actually what they're truly looking into. And like I said, that timing thing was the biggest thing that they were trying to focus on. And there's my references, and that concludes my PowerPoint. Thank you.